back to doing charge nurse this shift, so let's recap how my shift went. As I was doing charge, I started at 6 a.m. So got report on the unit, and then we had 2 admissions that were going to be coming at 7 a.m. once the nurses got there for like the bedside nursing. So I set up the rooms for the nurses so that way, just in case the admissions came like right away, they were pretty much ready to go. How to find a blood pressure cable. Why is this always a thing? But anyways, I did end up finding one, yay. And then I went and got breakfast before I looked over the staffing for night shift. The night shift charges usually do the night shift staffing for like the following night shift. So it pretty much was all done. I just want to make sure, kind of take a look over it before going to the staffing meeting. And then when I got back from that, nurse had a question about mannitol, so I had to actually call the pharmacy about it. I restocked both of our med rooms because we don't have techs, okay? Like, why do we not have techs in the ICU? I don't know. But they were both low on some things, so I restocked both of them just to make things better for the nurses. Did some rounds with the ICU doctors, got a new admission. Then we had a code blue that I ran to. And after that, a nurse called me and they were in like a procedural area and said, hey, I need some sedation meds. They don't have any in this Pyxis. So I ran some meds over to that nurse before I gave our secretary a lunch. Got a patient cleaned up, and then a nurse had some AMA questions about the paperwork and whatnot. So we went over that. And then I drew some labs for a nurse that was just really busy and just trying to be helpful and be an extra set of hands. I realized that the way I like to define my shifts of being good or bad is not necessarily about like how busy it is and whatnot. It's about how I feel I was able to help people or help patients, help nurses, whatever it might be. Like, I get a lot of satisfaction out of being able to do things for people. And when I'm doing charge, if I'm stuck on the computer the whole time, it really like makes me feel like I had a bad shift, even if it wasn't really like a bad shift, if you catch my drift. Transferred a patient out of the ICU and then had another staffing meeting. When I got back from that, I stripped a room from a patient that had gotten out. Then we had some cord situations. Again, like, what's up with the cords? I don't know how to fix that and figure that out. And then spent about 30 minutes just doing like some staffing switches, closing rooms, moving nurses around for the night shift, and just figuring that out. Got updates on all the patients around 1700, and then 2 nurses needed ultrasound IVs on their patients. So I went and did both of those, and then I gave report at 1800. And that was my ICU shift recap.